Hi friends, my name is Gigi and the name of my channel is Gigi the Phenom. Welcome. This is my first episode. I'm not worried about lighting. I'm not worried about editing. I'm not worried about the visual in general. You got to start somewhere and this is my start. So welcome. Here on my channel, I want to talk about being a minimalist, talking about becoming debt free, also being financially free, being able to spend more time, with my family, and also being able to travel a little bit while not trying to actually retire per se, but cut back from working and still keep myself going. I'm about to embark on a surgery. So today is February the 3rd. No, the surgery is February the 3rd, excuse me. Today is January the 3rd. My surgery is 31 days away. So I'm going to do a countdown from today until my surgery day. And we'll see how that goes. Right now, I can't do the things that I would normally do. But I'm trying to get to the point where after the surgery, I can build my strength back up and do the things that I would normally do, plus things that I want to do more of. The type of surgery I'm having is called a disc replacement, anterior cervical discectomy disc replacement. They want to do a fusion initially, but I opted not to have a fusion. So I went and had a second opinion, and they told me I had an option. My C5 is damaged due to bulging disc. There's spinal stenosis there as well, and arthritis. So what is happening is it's pinched. It's causing me to have chronic pain on one side of my body, which is my left side. And also it's causing semi-paralysis. It comes, the paralysis does, and then it goes. But at some point, it may not go if it comes again. The reason I'm having the surgery after 7 years is because I'm at the point now where I'm tired of being in chronic pain. I'm tired of not being able to lift things. I'm tired of being limited in the activities that I can participate in, and it's affecting my work as well. So it's time now. And I've also had a grandbaby that I have not been able to properly bond with, and she just turned 1 year old. So I'm doing it for my grandkids, so I can spend more time with them and be more active with them. What are some of my symptoms? Well, when it started out as a pain right above my elbow, up in that tendon. They called it tennis elbow. And that tendon hurt, and it hurt, and it hurt. And I would wrap it, and I would, have it massaged. And I started doing dry needling. And then my arm was partially desensitized on the top. After some years of doing that, it wasn't bothering my hand or anything. It was just my arm. So I said, you know what? We're going to keep on going. I'm going to push forward. And that's what I did. So over time, it started creeping down from the elbow on down the arm, on down to my hand. So did physical therapy. It wasn't working. Massage wasn't really working either. So I started doing dry needling. So I did dry needling for 3 years. I was told by my physical therapist, he said, one day the dry needling is not going to work for you. I said, I know. So the pain kept creeping in different areas. Like I said, it went from my elbow, went all the way down to my fingertips. Then it started going the opposite way. It started going from my elbow on up, the back underside of my arm. That was desensitized. Then it started moving up to my shoulder. Then it went up to my neck. So Now it spans from the nape of my neck all the way down to my fingertips. I have some areas that are already desensitized on my back and on the back of my arm. How do I know they're desensitized? Because of dry needling. When they put the needles in, I couldn't feel anything. They asked me, do you feel anything? This might hurt. I don't feel anything. So I do have some possible nerve damage that I don't know if it was reversible or not. But once I have the surgery, everything should start back working. It should start back, firing like it had been prior to me having been injured. And why did I opt for a replacement instead of a fusion? With the fusion, I would have been very limited in my range of motion with my neck. The fusion also would cause the rest of my spine to weaken, and I didn't want to risk having to have another fusion and another fusion and rods and different things of that nature. So I got my second opinion. When I got my second opinion, they said you have an option. You can try it since you only have one disc that's damaged. You can try that, and I'm going to try that. And I did my research. I went on YouTube, did research. I had patients where I worked whom were in the same predicament, whom said they would not get the surgery because they didn't want a fusion. And there were some who had the surgery who had to have multiple fusions. So after careful thought and doing my research and talking to different doctors and weighing my options, I've opted to have the cervical disc replacement as opposed to the cervical fusion. Right now, in addition to having the chronic pain every day, I'm starting to have migraines. And so with the migraines, it's just confirming it's time to have the surgery. So follow me on my journey, 31-day countdown to my cervical disc replacement. If you have any questions, any comments, any words of encouragement, any feedback, anything you want to say whatsoever, be nice now, be nice. Please leave your comment down below and subscribe and follow me on my journey. Thank you for tuning in, and thank you for subscribing if you subscribed. And if you hadn't subscribed, please do. Stay a while. I'll talk to you all the while. Later.